It was late, the house was quiet, and I had just sat down with a bowl of dinner when, out of nowhere, I felt this urgent need to get to the bathroom. I remember thinking, why does this keep happening on evenings that should be relaxed? I made a tiny kitchen tweak that night and said to myself, I need to learn more. So welcome back to Earthy Remedy. Today, we're talking about small, safe kitchen steps that can support bladder comfort. Nothing that replaces care, just things you can try thoughtfully.
Hello, I'm Fiona. We'll keep this very practical. One small change you can try for 7 to 14 days, clear ways to track results, and very specific stop rules. We're joined by Dr. Maya Chen, a urologist who will help us name the red flags, and Asha Patel, a clinical herbalist who keeps our recipes culinary and gentle. The promise? By the end of this episode, you'll be able to make 2 simple kitchen demos and run a safety-first microtrial.
Before we bring them in, let me say this up front. What we're offering are food and fluid strategies that are low risk when done carefully. They are not cures. If you have fever, flank pain, or blood in your urine, those are reasons to seek care right away. We'll say that several times today because safety matters.
Thanks for having me. I'll be direct. Bladder urgency can come from many causes. Simple bladder overactivity, irritation from certain foods or beverages, as well as bacterial infections. Part of our job today is to help listeners tell the difference between occasional irritation and signs that need antibiotics or urgent evaluation. I'm really glad to be here. I focus on pairing traditional, food-based herbal ideas with clear safety boundaries. My aim is to keep recipes culinary, pleasing, low dose, and accessible, so people can try them without worry.
Great. Dr. Chen, can you walk us through what's actually happening in the bladder when someone feels sudden urgency? What separates a bladder sensitivity from a urinary tract infection?
Urgency is the sensation that you need to void immediately. It can come from an irritated bladder lining, from nerves that are a bit overactive, or from an infection. A urinary tract infection, when bacteria invade and multiply, typically brings together symptoms: urgency, frequency, pain or burning with urination, sometimes blood, and frequently generalized symptoms like fever. Asymptomatic bacteriuria means bacteria are present but without symptoms. We usually don't treat that outside of pregnancy or before certain procedures. The key for listeners: if you have systemic signs, fever, nausea, flank pain, seek care promptly. If it's just mild irritation or new urgency without those red flags, there are sensible steps you can try and track.
That distinction helps so much. Thank you. Asha, from an herbal or food tradition view, what are the low-risk approaches people ask about most often?
People ask about cranberry, probiotics, herbal infusions, and timing of fluids. My approach is culinary. Use whole foods and gentle infusions rather than concentrated extracts, unless you're working with a clinician. Cranberry at a culinary dose can improve taste and palatability for a hydration strategy. Probiotics can support a healthy microbiome when chosen appropriately, and herbs like ginger or mild citrus notes are mostly about comfort and palatability rather than dramatic therapeutic claims.
Let's be precise about the evidence. The research shows modest, sometimes mixed benefits for cranberry at food-like doses. There are signals, but not airtight conclusions. Probiotics have some promising data for certain populations and formulations, but strain, dose, and product quality matter a lot. From a nutritional standpoint, focusing on regular, balanced hydration, fiber to support healthy bowel function, and reducing known bladder irritants for some people, like high-acid sodas, artificial sweeteners, or strong alcohol, can help with symptoms without introducing risk.
Exactly. I advise patients that small, measured changes can be useful, but they should watch their symptoms closely. Also note medication interactions. For example, concentrated cranberry products can interact with certain drugs, and very high vitamin C doses are not appropriate for people with a history of certain kidney stones. That's why we include clear contraindications in the show notes.
Okay, let's switch to the practical part. We'll read a short prep checklist slowly so anyone cooking along can gather what they need. Cup, small pot,
spoon, measuring spoons, a mug, plain probiotic yogurt or a dairy-free fermented option, oats or cooked whole grain, fresh or frozen tart berries, fresh ginger, a lemon or small citrus, low-sugar cranberry juice or dried cranberries to infuse, and a pinch of sea salt or trace minerals. Take a breath. This is single-serve, single-change framing.
If you're pregnant, trying to conceive, have a history of kidney stones, or are on warfarin-like medications, pause and check the show notes and consult your clinician before trying concentrated cranberry or new supplements. We keep our on-air recipes culinary and low dose to avoid those risks, but check first if any of those apply to you.
Demo A, Hydration Infusion. I'll read the ingredient list slowly. 1 cup of water to make a concentrated infusion. 2 tablespoons low-sugar cranberry infusion concentrate. We'll show how to make that. Diluted to a total of 1 liter across your day. A small pinch, about 1/8 teaspoon, of sea salt or a mineral pinch for palatability and electrolyte balance. A small slice of lemon or orange for flavor. And optional grated ginger for warmth. This is culinary. No concentrated powdered extracts on the stove.
Quick note on math and dosing. If you make a 1-cup infusion with 2 tablespoons of low-sugar cranberry concentrate, you're using a culinary level amount. Then dilute that to 1 liter, so the daily intake is mild, not therapeutic dose cranberry. The goal is palatable hydration, not high-dose supplementation. If you prefer, use 2 tablespoons of real cranberry juice, low sugar, or steep 2 tablespoons of dried cranberries and strain. Either approach keeps the amount lightest.
Step by step for a simple cranberry infusion. Step 1. Pour 1 cup of water into a small pot and bring to a gentle simmer. Step 2. Add 2 tablespoons of low-sugar cranberry juice or 2 tablespoons of chopped dried cranberries. Step 3. Add a small thumb-sized piece of grated ginger if you like warmth, about half a teaspoon grated. Step 4. Simmer gently for 3 minutes. Do not boil aggressively. Step 5. Remove from heat and let it cool for a few minutes, then strain into a cup. Step 6. Add a tiny pinch of sea salt, about 1/8 teaspoon, and a squeeze of lemon. Step 7. Measure out 60 to 80 milliliters, about a quarter cup of this infusion, and add to a liter of water in a bottle to sip across the day. That's your diluted hydration infusion.
Sensory notes. You'll smell the ginger and citrus, and the water will have a soft pink or golden tint depending on your cranberries. This is meant to make sipping more appealing, help you space fluids across the day, and avoid sudden large intakes that can worsen urgency for some people.
Timing is important. Drink smaller amounts spaced across the day rather than large boluses right before bed. If nocturia, waking to urinate at night, is your concern, cut back on fluids 2 to 3 hours before bedtime, but stay comfortably hydrated during the day. Also, if you have kidney stone history, discuss cranberry and high-dose vitamin C with your clinician because oxalate risk varies by stone type.
A quick nutrition pointer. Fiber and regular bowel habits matter too. Constipation can press on the bladder and worsen urgency. So while you're trying the hydration infusion, also aim for consistent fiber, whole grains, cooked oats, fruit, or vegetables. This helps overall pelvic comfort.
Bridge. Take your bottle, your mug, your 1-cup infusion. Pause and get ready for Demo B, the Probiotic Forward Bladder Bowl. This is a quick, single-serve meal that pairs probiotic food with cooked fiber and tart berries. It's breakfast-friendly or a soothing snack. Demo B. Ingredient list. 1/2 cup cooked oats or other warm-cooked whole grain, 3 tablespoons plain probiotic yogurt or 3 tablespoons of a dairy-free fermented yogurt, look for live cultures on the label, 1/4 cup tart berries, fresh or thawed frozen, 1 teaspoon grated fresh ginger, a squeeze of lemon or a scant teaspoon of lemon zest, a sprinkle of ground flax or chia for cooked fiber, and a drizzle, 1/2 teaspoon, of maple syrup or honey if you want sweetness. Note, if you're lactose intolerant, use a confirmed probiotic dairy-free option that lists live cultures.
Assembly steps. Step 1. Warm your cooked oats in a small bowl, about 1/2 cup. Step 2. Stir in 3 tablespoons of probiotic yogurt while the oats are warm, not boiling. Warm temperature helps meld textures, but avoid high heat that kills live cultures. Step 3. Fold in 1/4 cup tart berries and 1 teaspoon grated ginger. Step 4. Add a sprinkle of ground flax or chia for fiber. Step 5. Finish with lemon zest for brightness and, if you like, 1/2 teaspoon of honey. Taste and adjust. This is about palatability and digestive comfort.
Why this works from a nutritional standpoint. The combination gives you live cultures from the probiotic yogurt, which may help the microbiome, cooked fiber to support regular bowel movements, and tart berries for low sugar flavor and antioxidants. Remember, the evidence for probiotics specifically preventing UTIs is evolving. Some strains and formulations show promise, but product quality matters. Use well-labeled products and stick to culinary servings in this demo.
And a safety note on probiotics: in generally healthy adults, probiotics at food level amounts are low risk. However, in people with severely compromised immune systems or certain medical devices, discuss with your clinician. And always tell your clinician about new supplements or high-dose probiotic regimens. Here we are recommending food-level amounts in a bowl for most listeners.
Okay, storage and serving tips. For the hydration infusion, make the 1 cup concentrate fresh and dilute to your liter bottle each morning, or make a small batch and keep refrigerated up to 48 hours. Warm the probiotic bowl slightly, only if you're using live culture yogurt. Don't heat it above lukewarm. Eat the bowl in the morning or as a mid-afternoon snack. Time it so you're not heading immediately to bed after a large meal if nocturia is your issue.
Now, how to run a 7 to 14-day microtrial. Pick one change, either the hydration infusion or the probiotic bowl. Track simple daily metrics: number of urgency episodes, number of nocturia events, and a 1 to 10 discomfort scale after voiding. Log the time of day you consume the demo and note any other changes, like a new medication or travel. If symptoms worsen or you develop fever, flank pain, visible blood in urine, or persistent severe burning, stop the microtrial and contact your clinician immediately.
Here's a listener-friendly example script you can bring to your clinician. Hi, I tracked urinary urgency for 14 days while trying a low-dose cranberry hydration infusion. I recorded X urgency episodes per day, down from Y, nocturia changed from A to B, and my discomfort rating averaged Z. I didn't take antibiotics. Can we review these notes and next steps? Keep it short and factual. Clinicians appreciate concrete logs.
Seek immediate care if you have fever, flank or back pain, persistent vomiting, sudden severe pelvic pain, visible blood in your urine, or severe worsening burning on urination that does not improve. If you develop any of these, call your clinician or urgent care right away. Also, if you're pregnant, discuss any urinary symptoms with your care team. Pregnancy changes thresholds for treatment. On the matter of interactions and contraindications, avoid concentrated cranberry extracts if you're on warfarin-like medications without pharmacist guidance. If you have a history of calcium oxalate kidney stones, consult your clinician before increasing vitamin C or consuming large amounts of certain berry concentrates. We've uploaded a pharmacist-reviewed interaction sheet to the show notes with specifics so people can check quickly.
We also want to be realistic about outcomes. Some people may notice small improvements in frequency or comfort with these changes. Others may not see a difference and will need further evaluation. That's why the microtrial and the tracking are so useful. You'll have data to bring to your clinician, so you're not guessing.
Before we close, a few practical troubleshooting tips. If the hydration infusion tastes too tart, add more water in your bottle and reduce the infusion fraction. If the probiotic bowl causes bloating, try a smaller serving of yogurt or switch to a dairy-free fermented option, and keep the grain portion modest while you adjust. And remember, one small change at a time.
A final accessibility note: if fresh ingredients aren't available, use thawed frozen berries, dried cranberries for infusions, and shelf-stable cultured dairy alternatives that list live cultures. The goal is practical, low-cost, and doable.
We've placed the exact ingredient lists, dilution math, and the 7-14-day tracker in the show notes, along with the pharmacist-reviewed interaction sheet
and clinician communication scripts. Use those tools. They're meant to make this safe and simple.
All right, let's bring this home. One small challenge for you. Try one demo this week. Log 3 simple metrics each day and notice how you feel. Tag @EarthyRemedy with a photo or a 15 to 60-second voice note about what you tried and how it felt. We love hearing your versions. What did you change? How did it taste? And did it help with sleep or nighttime urgency?
And if your log shows worsening symptoms or any red flag items, stop the test and contact your clinician immediately. Bring your notes. The data you collect can be very helpful in getting the right treatment quickly. I'll leave you with this. Small, repeatable rituals, sipping a pleasant flavored water or nourishing a warm bowl, can change how you feel day to day. They're not magic, but they can support comfort in ways that fit your life.
Thank you so much to Dr. Maya Chen and Asha Patel for joining us. And thank you for listening. Remember our signature. Listen to your body. Trust the earth. Feel the difference. If you liked this episode, tag us on Instagram at @EarthyRemedy and download the safety sheet and microtrial tracker in the show notes. You've got this. One small step, one safe experiment at a time.
Next week, we'll explore practical anti-inflammatory pantry swaps you can make in 5 minutes. Until then, take care and be gentle with your body.